Hello and welcome to Triage, rapid legal lessons for busy healthcare professionals, a podcast created and produced by K&L Gates. Each episode is designed to highlight important developments in health law and analyze the impact on our clients and friends of the firm. We hope you enjoy this podcast.
So today is part 2 in a series of 2 series that we're covering today on long-term care, nursing homes, and the comparison with the United States and Australia. Part 1 had previously discussed the effects of COVID-19 pandemic in the nursing homes and long-term care space in the United States and Australia, and really focused on the issues that everyone has been focused on to date. That's both the operational and legal issues, and the way in which regulatory authority and industry leaders are addressing these issues, both in the United States and Australia. Part 2 is where we are today, and we're talking about what is the future of the industry? Where do we go from here? And secondarily, what does a successful organization look like? So the 4 of us are going to be discussing that today. Look forward to a very positive discussion.
My name is Myla Reizen, and I with me have 3 other individuals that are going to introduce themselves as well. I'm a partner with K&L Gates, focusing on healthcare, and I do both the acute and post-acute side. And my practice is largely on the regulatory, investigation, compliance, as well as corporate integrities with a unique area. In terms of the specific topic we're covering today at nursing homes and care facilities, I spend an extensive amount of time providing resources and information to this community during this pandemic. And Paris and I both thought it made sense, another one of the speakers here is going to be introducing himself, to really talk about what's going on between the United States and Australia and talk about a comparison between the two. And what we wanted to do was also not just talk about it on our side, but also bring in some very nationally recognized quality consultants with us that you're going to hear from that are going to talk today. So with Paris, do you want me to turn it over to you for you to give your introduction, please?
Thanks, Myla, and good evening over there. Yes, my name's Petranis, and I'm a partner out of our Melbourne, Australia office. And like Myla, I focus exclusively on the health and aged care sectors. It's the only areas I do work with. And again, like you, Myla, I'm very much regulatory, but also with a commercial bent. I've been working in the aged care industry, and in particular residential aged care, for 20 years now in Australia, and have a lot of experience over that time. COVID has thrown a number of challenges forward for that industry, but in Australia, as Judi and I will touch on, we've also had some other challenges in the last 24 months in that sector which are impacting. So we're looking forward to a really great discussion.
It sounds great. And then, Bruce, do you want to take it from here and kind of give your overview of what you do? Bruce and I have worked together for almost 15 years now, back and forth. So we've been in the quality space, both in the hospital, in the physician side, and now the post-acute side for a number of years working together. It sounds like you have the same rapport with Judi, so it'll be interesting to see the camaraderie here.
Well, thank you, Myla. It's a pleasure to be here with everybody. I'm glad to be working with you and talking about this important subject, because we know that a lot of the issues with COVID relate to our post-acute care, long-term care arenas, and we want to make sure that we can help advance the quality and the safety in those environments. I'm the president and CEO of Cynosure Health. We're a national consulting organization that we're all about quality. And I think improvement is our DNA. What we want to do is to say that we know that it's a continual journey, and we'd like to help people accelerate. We can go faster. We have the tools, we have the know-how. We can go faster at how we improve in this country, and that's what our job is. So I'm delighted to be here with everybody.
And then, Judi, I would look forward to hearing your background, too. It seems quite extensive.
Thanks, Myla, and good evening to everybody. I live in Adelaide, South Australia, and I work for a national consulting firm, Ansell Strategic. My background is I'm a registered nurse, and I consider myself to be a career aged care nurse. So we provide consultancy and advisory services across Australia and New Zealand. I'm originally from New Zealand, so I have that background as well. And we really, our work is solely in the aged care space. And our aim is to help our clients to improve and, like Bruce is saying, to really accelerate how they do that and to do it with confidence and in a person-centred way so that we support, better ageing for older Australians. And I'm really happy to be here today talking with you all. And I think, this is challenging times. And I think this really sets the scene for how the sector can move forward and take confidence out of how well we've adapted or are starting to adapt to this new environment.
So I think just shifting now to that, we've covered a huge amount of landscape in terms of the guidance and what's happened in both areas. But now I think let's talk a little bit about the future. And with the statistics that we have both here in Australia, it's interesting to let's hear what everyone thinks about the future of this industry going forward. So maybe Paris and Judi, let's get your thoughts on that.
I think there are going to be impacts on the industry in Australia, but not necessarily the way that people first think. In Australia, our aged care regime, particularly our residential aged care system, has been under scrutiny for a number of years. Several years ago, we had some incidences of substandard care, which led to a Royal Commission in Australia, which is ongoing. So quality has been a very big focus here for a number of years. Judi alluded to new quality standards. We've got a new agency that oversees it. So all of that was well in train prior to COVID-19 hitting. It's probably part of the reason, as Judi again mentioned, that we've managed to, so far, be able to be on top of it, because we had a few years of really drilling in that compliance culture. So certainly from my end, do I think COVID is going to lead to drastic regulatory change or oversight? The answer is no, not more than we were already heading to. It's just an example for us to assess and to see how our systems are working. Where it is going to be relevant, though, is probably more on the financial side for providers. There's two impacts that we are already seeing. One is, understandably, people are concerned about putting their family members in residential aged care at the moment. We know that mortality rates are high for the elderly because many have multiple comorbidities. Given that, it's not surprising that many families, if they can, are electing to not place their parents or grandparents in nursing homes at the moment, hoping that sooner rather than later we may have the virus under control, such that they would perceive it to be safer for their loved ones to be in facilities. Of course, this then has an impact on occupancy in the facilities because you're not replacing departing residents with new residents. Another issue is how residential aged care is funded in Australia. One source of access to funds is through the payment of refundable deposit. As the name suggests, this involves the payment of an amount, often in the hundreds of thousands of dollars, which essentially serves as an interest-free loan for providers. And that can be a really large, pool of money. So if you've got a large facility, that could be in the tens of millions of dollars that you have to enable you to do capital works, to invest, etc. What we're finding through COVID is that as residents leave and providers have to pay out those refundable deposits, not only are new residents not coming in, but we're finding that those that come in choose not to pay those deposits and instead pay what we call a daily accommodation payment. That's causing enormous stress to a number of providers who, again, might need to pay out millions of dollars but don't get it coming back the other way, and it's hard to make that up on a daily payment. So we know that there are a number of providers under significant financial stress at the moment, and our expectation is that come, in a few months' time when the dust settles, we expect to see some consolidation in the industry and some providers not make it, to be totally honest, not come out the other end and have to be picked up. Is that COVID related? I mean, I would argue COVID was the straw that broke the camel's back, but if you found yourself in that position, you probably didn't have a great model to begin with. So it might actually clear up, a few providers who weren't as prudent as they otherwise could have been. In terms of day-to-day care and accreditations, I don't think we're going to have any drastic change from our regulators. But Judi, interested in your thoughts, of course.
Thanks, Paris. I think the level of impact of COVID has not been great enough to really force huge operational changes. I think that the industry has managed it really well. I think we've had very good support from the government, from our peak bodies, who have put out a lot of guidance, have done a lot to publicise the positive things that are coming out of this. So I think it's been reasonably well contained, and I'm not expecting that there's going to be, massive operational changes. I think one of the interesting things that will come out of this is the awareness amongst our staff, just what they can achieve in terms of containment of influenza, which has actually killed more people year on year than COVID has this year. So I think just that understanding again of infection control and how that can be contained, I think that is one of the things that will come out. And while it seems quite a small thing, I think that will have quite a large impact going forward. I think one of the other things that will come out at from an operational perspective is that the use of media, the way to keep families connected, because we do have, a lot of residents who don't live in the same state as their children, and keeping them connected in a much more regular way. It was always there, but we just haven't used it really well. So I think that will come out of it. And I think it's going to really force that person-centred approach, that everybody is different, everybody has different needs, and how do we, address people's personhood throughout all of this as well. So some quite low-level operational things. But I agree with Paris. I think there will be some consolidation, and I think in some areas that will work well. I do have a concern about rural and regional Australia and how that might affect them. And I think there is an opportunity to really rethink some of the subsidies that are offered by the funder to regional and remote Australia. This is an essential service for a lot of people. Our population is very centred in the capital cities. It's centred around the coast of Australia. But out in the middle of Australia, there are still a lot of older people who want to stay connected with their own community. And it's a very difficult gig, if you like, to get the calibre of staff that you need in this, new environment that we have with the new standards, and to get staff, because often some of them travel hundreds of kilometres to get to work. And what are some of the concessions that can be put into the funding to really reflect this? Because we can't afford to have the situation where these providers, who are really well-meaning, committed community groups often, have them fall over just because this becomes too difficult. And I think this is, as Paris said, this is the straw that breaks the camel's back with the cost of managing COVID. But, it's highlighted a number of aspects which were always there. And I think we've got to work really hard to support these facilities to maintain their business in these local areas. But other than that, I think the impacts that we're going to see and the strategies that are going to come out of this, I think we were going to see it anyway. I just think it speeded up the process.
Yeah, I think in the United States, I think we're going to actually continue to see more and more cases. Bruce, I don't know your thoughts, but I think that our numbers are now getting more crystallized in terms of the format and the reporting. And so I think our data is going to continue to be more and more transparent. And it's been reported that the numbers that we're coming out with mortality rates are actually lower than what they are. So I think that with the increased data, not that the numbers aren't high right now, but I think they're going to be higher as the data continues to come out. And I think what we're also seeing is now people taking a look back and figuring out what happened here and getting to the root cause of what happened, that it's just not one area, it's just not one facility, but this is an industry that's really impacted. And so I think we're going to start seeing look backs now and really doing deep dives as to what happened and what can be approved and what can be approved immediately. Because I think that there are a lot of places that are still in a very acute state that need to have this addressed. I think also we're going to continue to see surveying on our end and surveying results. The government just set aside over $80 million just for surveying. So we're going to start seeing surveying around the country, or not, I shouldn't say start, continue to see the surveys throughout the country in key areas. they've identified, one being infection control. Also, on the legal side, there have been already wrongful death cases filed, as well as now criminal actions filed in some of the states. So, and in addition, when we have our surveys, there are what are called civil monetary penalties assessed against the organization. And one organization was assessed over $600,000 due to the some of the initial alleged findings initially that have come out. So I think we're going to continue to see operational changes, information coming out that'll lead to more information. But then I think we're going to see a lot on the administrative, civil, and criminal side in terms of really a lot of enforcement and deep dive from the different parts that are responsible for that. I do think that one area that we're also going to see that you touched on in Australia, and Bruce, I don't know your thoughts on this, but I think we're going to see the same sort of, some of these facilities won't make it. It's a huge amount that they've had to withstand here in terms of the lack of the personnel, just what is now required for them to continue to be in business. And so I do think we're going to see some that aren't going to withstand this.
Well, I can't believe the contrast between the United States and Australia. It's dramatic. This is a crucible moment in the U.S. and the long-term care industry. We're not going back to the old way. This is something that's going to change it forever because of the magnitude and the impact. And people are just awakening now about just the profound numbers that Myla described earlier of the people that have died in these kinds of settings. So I don't think we're going back. And, the CDC is going to ensure that. They're going to make sure that skilled nursing facilities and other long-term care places submit data weekly to the National Health Safety Network, and that data is likely to get publicly reported. What does that mean? That means that families are going to know which facilities are high COVID facilities or had experience in COVID, and they're going to probably not allow their loved ones to go there. So I think that's going to put tremendous pressure, both financially and operationally, on organizations. The healthcare workers are going to also find out exactly who's a COVID nest and where do we have to go to avoid that potential risk, not only ourselves, but our families as well. So the staffing issues are going to be profound. So the organizations that fail to step up to this crucible moment, to really rise to the occasion during this time, I think are in deep jeopardy for the long haul. But there are some good things that are going to come out. I totally agree that video conferencing has been a real boom. It's telehealth for patients and for their families, so that they can connect. People all across the country and the world are connecting with their loved ones that they didn't before because they couldn't imagine not physically being in the same room. And I think this pandemic has told us about how we can connect with loved ones in new ways, predominantly through FaceTime and other video conferencing strategies. I think that's really powerful. And the final thing I'd say is that, state and local regulators have been talking a lot now in the past few weeks in particular about the disparities in social determinants of health. Are there other factors that play into this that we need to spend time on? So I think we're going to see more and more as that plays out too, as we understand what are all the factors, both institutional, maybe in vulnerable populations or super vulnerable populations, that we need to provide additional care and resources. And I think the surveying angle that you mentioned, Myla, is going to go particularly down that area. Those facilities that have high numbers of vulnerable populations or people that struggle in these social determinants of health are going to have extra scrutiny and extra oversight. But I do think there's an opportunity for people to respond to this in a way that really sets them out. And I have hope that this is going to actually be a positive change for both the people working in the industry and also the patients and communities we serve.
I think to just wrap it up on a positive note is what do we all think are characteristics of a successful long-term care facility going forward? If we had one or two sentences, how would we describe what we think that a successful organization would look like? Bruce, do you want to take that?
Sure. Yeah, Myla, I think there are going to be successful organizations out there, successful groups and people, and they're the ones that are going to embrace this, what I call culture of protection. That the people that they are caring for, the people in their stewardship, are really so important to them that they want to protect them at all costs. And they're going to go the extra mile to figure out how to do PPE correctly. They're going to figure out how to implement systems. And they're going to be really, at the end of the day, proud of what they accomplished and how they might have had COVID deaths before, and they're going to be COVID-free and infection control so much better in the future that it's going to be a great place to be.
Yeah, I agree with that. I think the culture is going to be critical. And I also think it's the places that are going to be able to really learn from all of the lessons learned out there. I think it's critical, lessons learned from what they went through and lessons learned in the industry, whether it's with PPE, whether it's how to address testing, how to address isolation, telehealth. And so I do think that from a positive perspective, there's going to be organizations that are going to now know what to do, even better than what they've been doing. And then there's some that are going to change based on what they're doing. But I think those are the ones that are going to really be successful going forward. And then I'd love to hear your thoughts, Paris and Judi, on that.
What I found fascinating by this is, Bruce, I agree totally with your point that there's this, very big disparity between what's happening and happened in the US and what's happened in Australia. The answer to the question from my end is exactly the same as yours. It's those that have a good culture and a culture that focuses on the individual and person-centred care and compliance. So they're the organisations that are going to be successful going forward. But to be honest, they're the ones that were successful previously and that will always be successful. And this is just going to really bring it to the fore. And I mean, Judi, your thoughts?
Yes, I think, I agree with everything that's been said. And I think one of the ways that organisations can do this is to really understand and establish a sound and effective governance program. I think they have to be much more robust in the way that they are looking at incidents, are trying to work out what the lead indicators are for some of these issues so that they really get ahead of the game and have a program that enables their staff to understand exactly what are the inputs in order to get these great outcomes. How do we monitor that? How do we address it? How do we adapt? How do we be agile and have a really timely response to some of these issues? So I think, in a nutshell, it is having a really good governance program that underpins a really robust and timely response so that they can move quickly when things are happening.
Yeah, I think that all makes sense. So I think that concludes our podcast today, unless anyone has any last thoughts. But we've had a great conversation today. It's been very, very interesting to see the differences between Australia and the United States. And I think we've learned so much from both of us talking today. Thank you to everyone.
Thanks again for listening to Triage, rapid legal lessons for busy healthcare professionals. New episodes are available for download through iTunes, Google Play, and other podcast applications. By subscribing to Triage, you will receive timely notifications of each new episode. Also, if you have any topics that you would like to hear discussed on Triage, please don't hesitate to email triagesupport@klgates.com. We would love to hear from you.